Hi there, welcome to the Healthcare Facility Election Judge Training. I'm Christy Mays. I am the Programs and Services Coordinator here at Blue Earth County.
And I'm Mike Stolberger. I'm Director of Elections for Blue Earth County. And today we will walk you through the Healthcare Facility Training. And Healthcare Facility Outreach Voting is really important. And so as an election judge helping in this process, your role is pretty critical to its success. What you're going to do is you're going to ensure that the access for voters living in those facilities is met and you'll allow them to vote in a process that protects the integrity and the accuracy of our elections overall. Voters who vote through the Healthcare Facility Outreach voting process will need to make sure that their privacy is respected throughout this entire process, and we'll talk about that as we work through the training today.
Some things that we have on the agenda for today, we're going to talk about some of the requirements. We're going to talk about what outreach voting is, and also what agent delivery is of absentee ballots. We'll define out healthcare facility for you, and we're also going to go through some of the responsibilities and some training exercises as well if we have time.
All right, so let's talk about the training requirements first. So as a healthcare facility outreach election judge, you first have to be trained and certified as an election judge. That occurs every 2 years and it requires at least 2 hours of training. So while you may be serving as a healthcare facility judge, you also need to be sure that you have received your full training and certification as an election judge in Blue Earth County. Once you've reached that level of certification, you will complete this additional hour of training. And this video is that first step towards that additional certification as a healthcare facility outreach judge. This video will last about an hour. We also have another video on our website that we'd like you to watch, and that is a video about aging sensitivity, and that was created in partnership with the Minnesota River Area Agency on Aging, and that'll be found on our website. Once you've completed both of those steps, our elections office staff will be in touch with you to make sure that you understand your assignment for your healthcare facility outreach, and then we'll also do some on-the-spot training to make you familiar with the materials and the supplies that you'll be bringing out to the facilities with you.
Healthcare facility outreach voting, we have to make sure that we cover who's eligible to be a voter in a healthcare facility. We need to also make sure that we have our contacts within the facility set. We have to cover how we get our materials to and from the facility and what the application looks like. We also want to make sure we dive in a little bit more in depth with providing assistance to voters and what that means for you.
All right, so when we talk about healthcare facility outreach voting, sometimes election judges and residents of the facilities get a little confused with what that voting looks like in contrast to an agent delivery of an absentee ballot. So let's talk about that a little bit. First off, the outreach facility voting is actually where the residents are permanent residents of the facility, and they're going to vote by absentee ballot while at the facility with the assistance of our healthcare facility election judges. That is different than an agent delivery process for an absentee ballot. And in that instance, the residents are temporary residents of the facility, and they don't determine that or they don't claim that as their permanent residence. So in that instance, they're going to receive a ballot for the precinct in which they do reside on a permanent basis, but our election judges can't bring that to that voter. That needs to be delivered by a different sort of process where different agents will deliver those ballots. Those agents have a personal or existing relationship with the voter. That allows them to vote on that home precinct ballot rather than the precinct ballot that you'll be bringing out there for your healthcare facility voting process.
During the 7 days preceding any election and up until 2 o'clock on election day, a healthcare facility patient may designate someone to be their agent. They must authorize that in writing, and the agent will pick up and return the absentee ballot from the main elections office here at the historic courthouse. The ballot must be back to our office by 3 o'clock on election day.
So remember, that process is different than the process that we're going to talk about for the remainder of this presentation for this training. That is going to be a process that's going to happen individually for voters who are not claiming that facility as their residence or their permanent residence for elections purposes. So with that clarification, now let's actually start talking about exactly what is healthcare facility outreach voting. So first off, healthcare facility outreach voting is the responsibility of the municipal clerk. So usually that's a city clerk, or sometimes it might be a township clerk. They have the responsibility to initiate all that outreach to the licensed healthcare facilities, to schedule the times for that voting to occur in their facilities, and then also work with the facility staff to prepare any materials, get applications completed in advance, and all of those other logistical pieces. In Blue Earth County, we play a pretty instrumental role in that outreach process, so we do a lot of this work on behalf of our clerks. That means your contacts at the healthcare facilities are going to be more familiar with Blue Earth County residents in almost all instances. So just be aware that they might know our names more than the municipal clerk's names that would otherwise be responsible for this process.
Healthcare facility outreach voting must be administered during 20 days before the election. We can't start any earlier than that. The healthcare facility would be a hospital, a residential treatment center, a nursing home licensed to serve adults under Minnesota statute 144A.02, or any other institution licensed under Minnesota statute 144.50.
All right. And so when we actually start reading some of those statutes, we get a clearer definition of what it means to be a healthcare facility. And so really, if we want to think about healthcare facilities, we're going to think about them as a licensed hospital or other institutions similar to that, or any of our nursing homes that are licensed to serve adults under state law. So when you think of a facility, the facilities that you'll be going out to are definitely going to be licensed. And again, we're going to be spending most of our time providing that outreach in licensed nursing homes.
Before you go, if you're our judge for healthcare facilities, before you leave home, you want to make sure that you have the things you need to be successful on your election day in the healthcare facility. So you want to make sure you've got comfortable clothes on. We want to make sure that we respect that we don't have any campaign materials on any of our clothing. Make sure you pack the necessities that you need: medications, emergency information. Our number will be part of that information, and then of course snacks and things that you might need for throughout the day. As far as the healthcare facility employees, we want to make sure that you've got your residents ready and the materials are ready to go.
And our contacts at the facilities are also going to be around our residents during that time period and providing assistance to our election judges. So they will want to make sure that their other duties are also covered and that they're not bouncing back and forth between assignments. We're going to take care of all of the supplies for our election judges who are providing this healthcare facility outreach voting. And so those supplies are going to include several different items. And as we mentioned, you'll actually be introduced to these items when you come to your first assignment and pick up these materials from the elections office. But we'll just highlight them here real quickly. First off, you're going to have sealed containers to hold the absentee ballot envelopes and the other materials such as voted ballots. You're also going to receive identification badges that will show your name, but not your party affiliation, even though we'll ensure that we have party balance before we assign you and deploy you to help at a facility. We're also going to provide you with extra forms in case some residents decide they want to vote while you're there, even though they haven't applied with us. And then we'll also give you lists of information just so that you're prepared with everything that you'll need to complete the healthcare facility outreach voting.
Okay, some of those supplies include, we'll give you a master list of folks that are registered to vote within that, at that address. If we've received any list of employees of the residential facilities, we'll provide that to you so you know who could vouch for the residents. And then we'll provide envelopes, the secrecy envelopes, the signature envelopes. You'll have plenty of those to be successful. We'll include some pretty extensive instructions just to make sure that if you have any questions, you've got a resource. Incident logs, I voted stickers, and then the table and booths are normally provided by the facility.
All right, now you know what you're going to be provided with on election day. Let's talk about how you're going to use those supplies when you're actually providing healthcare facility outreach voting. So as an election judge fulfilling this role, as we already mentioned, you must be trained and you're going to be partnered up with another election judge. The reason for that partnering is so that we can ensure party balance and so that voters are going to be treated equally in the polling place as they're completing their voting. We do have a requirement that you travel together in the same vehicle. So when you arrive for your assignment on election day morning for our healthcare facility outreach locations, you'll have to select who's going to be driving. The reason for that is so that we can ensure 2 folks are always associated with the supplies, the equipment, and the absentee ballots. We will also make sure that the healthcare facility employee that you're working with has the right training that they'll need to be successful. And then they're also going to confirm the material pickup and return with us so that we can make sure they're aware of your time of arrival and also when we should expect them back in our office. Ultimately, your duties on Healthcare Facility Outreach Voting Day will involve providing an application to a voter, a resident who's wishing to vote by absentee process if they haven't already applied with us in advance. We'll then issue them balloting materials, or they're officially known as absentee balloting materials. And then really your largest responsibility, probably the responsibility that will take the most time, is actually providing assistance to that voter as they need that assistance, as they request it, so that they can complete the voting process successfully. Ultimately, the goal is to get that ballot returned to us in the sealed envelopes, which are then in sealed containers, so that we can ensure the integrity of that vote all the way back to our elections office.
All right, and so part of the outreach that happens ahead of time is each voter must complete an absentee ballot application. It can be completed ahead of time, like I said, or even during outreach. So if somebody decides on election day at the facility that they'd like to participate, they certainly can. Make sure that the forms are filled out completely and that we have the voter's name, date of birth, driver's license, or last 4 of the social, or an affirmation that they do not have any of those, and make sure the address, of course, is filled out.
All right, let's talk a little bit about signatures for voters. The voter must sign and date their application. It's signed by that individual who is making the request, and so we have to respect that. We cannot have powers of attorney. Others can't sign on behalf of that applicant. However, if an applicant is not able to sign on their own, they can request somebody to provide that signature in their presence, right? So that means that that individual who's providing that assistance and signing on behalf of that voter is also going to sign, but they're actually doing that as an individual, not as a power of attorney.
All right. And so when we're getting somebody signed up to be in the healthcare facility, we want to make sure that we're using the master list to determine whether or not that voter is registered prior to your election day. Okay, if they're registered, we'll be able to go ahead and fill out the absentee ballot application and issue registered materials. Voters who are not registered, who maybe have their registration challenged, will complete the non-registration process. And part of that process is the election day registration application that needs to be filled out.
All right. To talk a little bit more about that election day registration process for these non-registered voters, we want to remind you once again that that is going to be for somebody who's not on your master list, somebody who's not pre-registered at that facility's address, that's not listed in the voters' records as their permanent residence for elections purposes. You're also going to need to re-register a voter if their record on the master list indicates that they are challenged for some reason, meaning that there's an issue with their registration that needs to be clarified and verified before we're able to update that to registered status. The voter registration application does require the voter to provide proof of residence, and there are several ways for the voter to do so. The instructions that are provided and the election judge guide and materials will have all of those details for you. Once that voter registration application is completed, the election judge who is providing that assistance and completing that registration process will fill out the very bottom of that form, which is the official use only portion. And that's where you'll indicate the proof that you used to verify that voter's residency as you completed the registration process. We will also need to provide some proof, and we'll document that proof on the application, or excuse me, on the absentee ballot envelope that will be completed. We'll talk about those things in a little bit more detail here as we move forward with the presentation.
All right. For non-registered voters in a healthcare facility, There's a list here of some of the things that we can use. Ideally, we need to prove who the person is and where they live. Proving where somebody lives, it would be a driver's license, ID card, or receipt. That can also be who they are. There'd be valid registration within that same precinct, a notice of late registration that they might have gotten. More so that you'll see that the employee of the residential facility will vouch for that person's ability to vote. They'll vouch that they're an actual resident of the facility. But if the person does have a driver's license or ID card, we'd want to use that first.
All right, yeah, as Christy just mentioned, the most common way for somebody living at a facility to actually prove their residency in that precinct or at that facility is to have somebody vouch for them. The reason for that is oftentimes the population being served in healthcare facility outreach voting won't have driver's licenses or identification cards. And if they do have them, it'll still have their older addresses on it, the home that they occupied prior to moving to the facility. And that is completely fine because we do have the ability to have those employees of the residential facility to provide that vouching. If they are able to meet the requirements to be the voucher and they are comfortable being the voucher, they can provide that assistance to the voter and use that as an acceptable proof of residency. We can also have other registered voters provide that vouching, and those other registered voters will have to be a resident of the precinct. Oftentimes they'll be residents of the facility, but that's not a requirement. They could be a registered voter of that precinct in which that facility resides.
All right. If an employee of a residential facility is on a certified list that was provided to our office ahead of time, they can vouch for an unlimited number of residents. Employees who are on the list do not need to show any other ID in order to vouch for a resident of that facility. I think we can head to the next one here. If the employee is not on the list, that's okay. They just need to demonstrate their employment at the facility, and that can be accomplished in a couple of different ways. They can show you an identification badge or a statement on the facility letterhead that shows that they're an active employee of that facility.
All right, and this would be an example of the voucher portion of the election day registration application that a non-registered resident of the facility would be completing. These, of course, will be provided to you. We just want to illustrate the options that are available, whether or not the person is pre-registered, as the box 1, registered today in the precinct, option 2, or the employee of the residential facility, option 3.
And these forms, Mike, are located on the back of the voter registration application.
Very good.
All right. So we kind of talked about this a little bit, but someone who is registered in the same precinct as the healthcare facility resident may vouch for them. This isn't as common as the employee of the healthcare facility being a voucher, but we wanted to let you know that this is an option. So if the voter wants somebody within that precinct other than an employee to vouch for them, they certainly can. Just remember, voter vouchers can vouch for up to 8 residents, and they have to know that they personally are residents of the facility and live in that facility, okay? Healthcare facility election judges, so you can also serve as a voucher, but you must reside within that precinct, so keep that in mind.
If voters are vouching for healthcare facility residents, so this is not a facility employee, but this would be a registered voter of that precinct, we do have to record the number of times they vouch for somebody because of that 8-person limit. So you'll have this form provided in your supply kit as well. We record the name of the voucher, their identification information, and then we would tally how many times they vouch for a voter, up to 8. Again, not common. Your most common way for folks to be vouched for would be through an employee of that facility.
All right. So remember, with the healthcare facility outreach voting, when you're providing assistance to voters, we must have 2 judges of different major parties providing that assistance. So in the facility, you and another judge will work in tandem with the same voter at the same time. You don't have to limit the number of voters that you can assist, so you'll work your way through all of the voters that are on your list that want to vote. or any additions during that day. Make sure that when you are providing assistance, that you provide the assistance to the level that the voter needs it. So don't assume that somebody wants assistance. Make sure that you ask them or they request your help. They must consent to your assistance before you're able to mark their ballot, and that has to be a clear statement that they would like help marking their ballot. All questions regarding any information on the ballot needs to be directed to the voter and not to others who may be with the voter on that particular day.
A little bit more about providing assistance. We want to make sure that the voter is receiving the assistance at the level they want, like Christy mentioned, but that it's also coming from the source that they want for that assistance. That means the voter may ask someone else to provide assistance besides you as the healthcare facility election judges. That person providing assistance can do that for as many voters in that facility as that request is being made. The only thing that you as an election judge need to be aware of is that person providing assistance cannot be an employer for that voter, nor can it be an officer of that voter's union. So if somebody else other than you as an election judge is providing assistance in the polling place on healthcare voting day, we want to make sure that you're asking that assister whether or not they are the voter's employer or an officer of a union that that voter is affiliated with.
All right. Some other information, and I think I'll let Mike go over this since he's explains it maybe a little bit better than me.
Sure. So Minnesota law, as it's written right now, says that a candidate cannot provide assistance. However, you'll see that this slide says that a candidate is allowed to provide assistance in marking a voter's ballot. That's because we have a state court decision that has told us that that is allowed. So election judges can provide assistance, the two judges of a different party. The voter can choose someone else to provide assistance based on their wishes. And that person now can also be a candidate if that's who the voter is asking for that assistance from. Just remember, really the best way to think about it is that the only people who cannot provide assistance is an employer of the voter or the voter's union representative. Whenever anybody is providing assistance, it doesn't matter if it's you as the election judges or somebody else of the voter's own choosing, we have to be certain that that assistance does not influence the voter's wishes. That means that you're only reading the question and its instructions. You're not providing any interpretation or you're not leading any other sorts of indications for that voter. Your opinion does not matter when you're providing voter assistance. We also want to make sure that the voter is given the opportunity, if they would choose, to show their ballot privately to an election judge to make sure that it's marked according to their instruction. If this is occurring, we want to make sure that both election judges are involved in that review. Where this might actually present itself is if the voter does choose to have somebody else provide assistance, but they want you to just do a double check to make sure that it's marked according to their directions and wishes. You're absolutely entitled to do that. We just have two judges involved in that process.
All right, so once a voter is finished voting, they will go ahead and place their ballot into the secrecy envelope that's provided. They can ask for your assistance to help them get that into the envelope. We will send along a way to close that envelope. It's actually a little glue stick. And then that secrecy envelope is placed into the signature envelope. The signature envelope is going to be where the voter is going to provide either their ID number or the last four of their social, and then they're going to sign that. You as the election judge will be able to sign as witness to that, and you want to make sure that all those steps are completed before the voter leaves your station. Make sure that if the voter has trouble signing, that they ask for your assistance in that signature, and you would sign their name and your name as well. So the voter signature and then your name next to it if that assistance is requested.
A couple other tips there just to help you be successful. If the voter cannot remember which identification number they used, they can provide both of them. So they could provide the last four of their social and their driver's license or identification number if they're not sure which they used. That way we back in the office can do a better job of matching that up on the voter's behalf. And then we'll also just remind you that if you are providing that witness role, you have to have been involved in that voting process. You can't be providing that witness role for a different ballot that somebody might bring to you that they received via the mail. All right, a couple of other things regarding completion of that signature envelope apply only if you're working with a non-registered absentee voter. So remember, this would be a resident of the facility who is not claiming that facility as their permanent residence, or excuse me, they are claiming it as their permanent residence, but they haven't done that in advance, that we don't have them registered. In this instance, we are going to complete many of the same fields, but we're going to have to handwrite most of that information because it won't be pre-populated on labels that have been provided by the county elections office. The voter is also going to have to make sure that the voter registration application is completed. We talked about that earlier. But then they're still providing that same identification number and signature like any other voter participating in healthcare voting. The difference on the witness side is that the witness now also has to mark the proof of that residence as it was provided by the voter. Remember, there's multiple ways for you to do that. So the the envelope has multiple boxes for you to choose from, but we have to document how we proved their residence if they were a non-registered voter.
All right, and so once the signature envelope is complete and signed, we want to make sure that we keep track of that envelope, and so that's going to go right back into our container that we're going to seal up at the end. And we want to make sure that if there's any unusual events or problems that occurred during our healthcare voting, that we document that on the incident log. Okay, make sure that when the voter ballots and materials are returned, they have to come back the same day immediately after the healthcare voting wraps up. And then also before you pack everything up and bring it back, make sure that you've accounted for all of those envelopes. So do a count of them and make sure there's nothing sitting on any tables or anything didn't get into that container. Make sure we're doing our double checks.
Very good. So now we're going to continue packing up all of your materials as you're wrapping up the voting at the facility for their election day. And we want you to think about a couple of other things, especially what you're doing with those unvoted ballots. It's incredibly important to make sure that all ballots are always accounted for, and that includes the ballots that you are not using, that have not been voted. Those ballots all must be returned to us. We never leave ballots behind or any ballot packets behind. It's unfortunate, but if a voter is not able to participate for any reason through the healthcare facility process while you're there, unfortunately, those materials must be returned to us unused, and then we'll work with the facility contacts to figure out if there's a different method or mode for that voter to participate in the election. You'll use the instructions that we provide on the morning when you pick up the materials, but the way that we'll mark those unvoted ballots may include marking them as spoiled in person, but we may also not have you do that because we'll actually mark them as spoiled in our system. So again, pay attention and follow the instructions that you receive as you pick up your materials. Lastly, related to those unvoted ballots, we want to make sure that the voter understands that they can't mail it in on their own at a later time. If they wish to do that, we'll have to have that individual work with our elections office to actually send them a different set of materials that will allow them to complete that process. It's absolutely an option for them. However, they just can't use the materials that you have because the materials you have are only for healthcare facility voting, which is a process that involves you as an election judge. So if a voter wishes to do that, have them contact our office or have them enlist the help of the facility and the facility's staff to make that request.
All right, so now we're moving into some of our question and answers portion of this. And so we'll start with voter A is a voter at the healthcare facility and she is unable to fill out the ballot by herself. Mike, what would you do?
In that instance, we are going to first off want to make sure that that voter does wish to vote, right? So if it's a matter of not being able to fill it out versus choosing to not fill it out. If the voter is unable to fill it out, remember, we're going to provide assistance at whatever level that voter feels is necessary or whatever level that voter asks for. Because remember, consent is necessary from a voter before we provide assistance. If the voter does request assistance, 2 judges of different parties, the 2 judges that are working there are going to be the judges that are providing assistance in that instance. If the voter says that they just don't want to vote at all, then we have an unvoted ballot. That packet of information, those materials will come back to our office to be spoiled by our staff.
All right, and so we have another voter who is filling out the ballot, and you check on them and you notice that they fell asleep and are only half done with the ballot. What are we going to do in that situation, Mike?
In that situation, we've got to be a little bit more careful with what we're doing, right? So first off, we want to be respectful of that voter, and so we're going to try to gently nudge them back into awareness and their interest in voting, but we're going to be respectful. If for some reason they're not able to re-engage in the process, or they choose not to re-engage in the process, again, those materials will not be cast as ballots or as votes counted. The voter, again, has to consent to the voting process and be involved in that voting process in order for us to complete it. In some instances, if you are able to re-engage them in the process and they're just too tired to complete, but they do want to finish what they have started and cast that, we'll work through that with them. We just have to make sure that the envelope is completed entirely and that we have their signature in that process. Any voter can stop voting at any time and only vote in the contest that they wish to vote in. It doesn't have to be a fully completed ballot.
Okay.
All right.
Okay, so and we're working with another voter on filling out a voter registration application. They're unable to sign their name, and so in this instance, what should we do?
So if we can't get a signature from the voter, remember we have a couple of options, right? The one option we don't have is that we can't have somebody sign it as a power of attorney. That does not exist in voting in Minnesota. So the voter can attempt to sign it using the best penmanship they have available to them, and we can use that as their signature. If that isn't even a possibility, if that just is not an ability that they possess at the time, then remember we can have somebody else sign it on their behalf, but they sign that voter's name, and then directly near it or below it, they're also going to sign their name. So that could be you as an election judge. It could also be somebody else of that voter's choosing.
All right. And so then we're working with a voter who is not registered and they don't have any proof of residency with them. How are we going to get that voter to register?
Right. So we have multiple ways for a voter to register. All of them do require proof of residency. If we can't physically prove that residency because the voter just doesn't have that capability, they don't have any documentation to prove that, the voter's option for registering and proving residency would be through the vouching process. Remember that any Minnesota voter can be vouched for, that's a state law, and our facility voters are no different. They're going to have a facility employee vouch for them in most instances, and that's acceptable. And remember, there's no limit for the number of times an employee at the facility can provide that vouching, provided they know the resident lives there. But if a voter would rather use somebody else for the vouching process, that's fine too, as long as that other voucher is also a resident of the precinct, not necessarily of the facility. In those instances where a resident of the precinct is personally vouching for that facility voter, then they have to be limited to 8 for that election.
Okay. So in a guardianship situation, can a voter still vote? Is there anything that we have to do differently in that situation?
So guardianship situations are not common, but they might be more common in healthcare facility voting. Under Minnesota law, guardianship does not automatically remove your right to vote. The guardianship can be in place without the court taking away somebody's right to vote. So if you're ever presented with a guardianship, we need to make sure that the voter understands that they must still have the right to vote, and we want to ask that voter if that's the case. If they're not sure, we'll have to clarify that, and if they want more information, you can share with them that revocation of their right to vote would actually be a court process, and that might remind them enough as to whether or not that has happened. But to summarize it, guardianship does not remove the right to vote. It's a court action on top of the guardianship that will actually remove somebody's right to vote.
All right. And so what in the instance if you've got a voter and they're taking a long time to fill out the ballot, how long do we wait for the voter to complete that process?
That's a really good question, and that's one that our election judges are going to have to kind of use their context of what's going on in the polling place and how that voter is reacting. So again, we want voters to have the right to exercise their ability to vote, and we want to help them through that process as much as we can. And so we might need to do some gentle prompting or reminding to keep a voter focused and engaged in the process. We're going to do that as long as it's reasonable and feasible, but if there's a certain point in time where the voter is no longer engaged or not able to be engaged, we want to give them one last opportunity, asking them if they wish to continue. Remember, if the voter doesn't consent to the voting process, then they're not actually going to complete that ballot. We're going to spoil out that ballot back in our office, so you're going to collect those materials and return them to us, not sealed, not signed. That won't be counted as a vote.
I think it's important to also note with that process, Mike, that if a voter isn't sure of a candidate or anything on the ballot, they do have the right to submit a fully blank ballot if that's their choice. It's completely up to the voter how they react to that. All right, so we have another voter who's a temporary resident at the facility. They don't live in the precinct that the healthcare facility is located within. What options do they have for voting?
All right, so in this instance, we are going to not be able to help them through the healthcare facility voting process, right? Healthcare facility voting is only for residents of that facility who claim that as their permanent residence for elections purposes. So if you have somebody who is at your location on healthcare facility voting day, and they say, nope, I'm registered at a different location, this is not my home, I'm returning to my home, then we respect that, and then we let the voter know that they still have the ability to vote through the absentee process. It's just not with you on that day. In those instances, those voters are going to have to request a ballot be mailed to them. That's an option that exists for them and for any voter in Minnesota for that matter. Or they can also vote through the agent delivery process that we mentioned at the beginning of our presentation. Remember, the agent delivery process requires that voter to request a ballot yet, but it also requires them to document a request that somebody pick up that ballot for them and bring that ballot to them at the facility to vote it through that process. That agent delivery process is only available for the week that precedes the election, so there's some other requirements there. And so what we would encourage you to do is to offer the online opportunity to request a ballot or give them our phone number so that they can request a ballot with us through that process. And then we'll explain those other options to that voter. Just remember, if they're not calling the facility their residence, they can't vote with you on the ballots that you have available.
All right, and so when you're working with a voter, there's some statements that we need to be aware of how we're speaking with a voter and covering the information on the ballot. And so I think we'll work through a couple yes/no questions and let's see how we do. All right, so we have a voter whose son has a power of attorney for them. Would you rather they vote for you? Is that an appropriate statement to make to a voter, Mike?
Election judges should not be making that statement. Remember, we don't ever influence or persuade a voter. And remember that power of attorney doesn't pull any weight in the elections world. It's up to that voter to cast their ballot or request somebody to provide assistance if they need help filling in the ovals.
All right. And so the next one here, asking a voter who they would like to vote for. I think we can all agree that that's probably not appropriate at all.
Yep. Remember, we never lead voters by saying, here's a candidate's name, is that who you want to vote for? You're presenting the questions on the ballot and you may be providing assistance in them reading that ballot, but we're not directing them to a candidate.
Okay, and another statement that we have, we can't say anything like if we remember a certain politician or that is the person doing commercials regarding X, Y, and Z. Would that be appropriate?
Yeah, remember again, we're not leading anything towards individual candidates. So we wouldn't want to address anything like that. Even though you think that might be helpful in reminding voters, voters might hear that as persuasion or trying to lead them in one direction rather than presenting all candidates on the ballot.
All right. So how about a statement along the lines of, would you like me to read or reread these instructions for you?
Yep, so that's a really good statement, right? And as an election judge working in a healthcare facility, you're going to say that a lot because voters may need those instructions repeated for many different reasons. And so feel free to offer that. And as an election judge, that's one of your most important roles, is to make sure that the voter understands what they're doing, and the instructions will help them understand that ballot in the voting process.
All right. Another question that you might ask is, would you like me to read you the ballot? That is completely appropriate and actually may be recommended if the voter has trouble seeing or what's on the ballot. The next question we have is if we would ask a voter whether or not they usually vote for a certain party. Is that appropriate, Mike?
Yeah, that would be a big no, right? Election judges should never ask a voter how they vote. Their party affiliation, their past voting history is private, and that is that voters' information that they can retain with privacy. So we would never ask that question. We also aren't going to ask that question because, again, that's leading, and we do not want to lead an individual towards a party based on what they're hearing you ask, or not ask them for that matter.
All right. And so then another question that we have is asking whether or not you really wanted your husband, your wife, your spouse to assist you.
Yep. And remember, the rule when it comes to assisting is it's up to the voter to decide the level of assistance they want. So if they want their husband, their spouse, their wife to provide that assistance, that's completely their choice. And as an election judge, you're there to facilitate the voting process.
Sure, sure. And so then another question referring to maybe a school district question that we might see on the November ballot. Do we bring up asking where maybe grandkids go? Because the question involves school funding. Is it appropriate to bring anything like that up to help them remember?
Once again, that would not be appropriate. Remember, we're tying everything back to the instructions on the ballot and helping a voter complete that process. And I'll also note on this one is that sometimes when you're helping facility residents, they're going to want to engage in conversation about things like this, the "oh, remember when" sort of conversation. And while that may be fun and it may also provide some levity on election day, we need to be very careful about that we aren't using that as an inroads to provide some sort of assistance that wouldn't be appropriate. So if a voter says, "oh gosh, my grandchild goes to that school, he loves that," you can say, "that's nice to hear, but let's go back to the question here, and would you like to vote yes or no based on the instructions provided?" Make sure that you don't misinterpret a voter's memory or some other statement that they're sharing with you as something other than what it is, and always tie back to the actual questions and instructions on the ballot itself.
Sure, sure. All right. So another question that we might have, and in fact we use quite a bit, is would you like me to read this question again? That is totally acceptable, and we would actually prefer that to make sure everybody has a clear understanding of that actual intent. Another question that we have here is, which of these names do you like the best? Mike, is that appropriate?
Yeah. So an election judge would never want to say that, right? We're going to present all names on the ballot and allow the voter to make their selection based on their personal wishes. This is another example, like I just illustrated with the school question, where a voter might think they're funny saying that they're picking a candidate based on which name they like best or which name sounds funny to them or something like that. In those instances, it's important for the election judge to remain very professional and make sure that you are respecting that voter's wishes and not degrading or second guessing their choices based on those comments that they made. If they are making a joke about that name, all you need to do in that instance is just re-engage them in the voting process by saying, "just checking before I move on, it looks like you want me to fill in the oval for candidate X," and then you proceed to the next question.
Sure, sure. And then regarding question 11 here, the voter has somebody along with them to provide assistance. And so you're asking them, is this the person that you would like to assist you with this ballot? Is that an appropriate question, Mike?
That is absolutely an appropriate question, because remember, we want to make sure that the voter is receiving assistance from the person that they wish to receive assistance from. And so this is your opportunity. This sort of question leads the voter into the ability to say, yes, I want assistance from this person, or maybe they'll disclose to you that they do not want assistance from this person and they're feeling intimidated by that individual. So yes, that would be a good question to ask.
All right. And then If somebody it looks like they're having some difficulty filling in their ballot or maybe even holding the pen, is it appropriate to ask them if they would like help writing on the ballot?
So this one we have to be super careful with, because remember, we provide assistance at the level the voter wishes to have assistance, but you're also there to be helpful. So use some really good judgment in this regard to make sure that you're not overbearing or imposing on somebody who is still very capable, but just maybe operating at a slower pace than you would like to see. So if there is some evident help that's necessary, we can kindly and gently offer that assistance, but we're going to respect the decisions of the voter in that regard.
All right. And then I think the last question we have here is pretty obvious, but we're going to go there anyhow. And so is it appropriate for you to ask your voter if it's okay if you fill out the ballot while they go to lunch and eat their lunch? Is that appropriate at all?
Yeah. So again, we don't want to go down that road, right? Voting is an important process, and you'll recognize that many of the folks voting at the facilities are very proud to be voting in whichever method they need to vote in order to complete that process. So we want to be respectful of that as well, and make sure that the voter is given every opportunity to complete that voting process as independently as they possibly can. We won't want to try to match that up with eating lunch or anything like that. Again, we want that voter to feel like this is an important process, because it is an important process.
All right.
The last couple of slides here are going to walk through some FAQs. And so these FAQs, we're going to click through them just so that you have them available. And then we'll talk a little bit more about some of the answers as we move through them. We've already explained to you who can and cannot provide assistance. We also can help you understand when absentee ballots are actually counted and processed. And then what we'll also do is, we've already talked about it, but we'll refresh that for you, is what happens if somebody won't sign the envelope. Then another question that oftentimes pops up for us is, can someone pick up an absentee ballot for their spouse if their spouse is in the facility? So you should be pretty comfortable with some of these answers, but let's just highlight some of them at the very end of the presentation for you. Okay.
All right. So when you are in the healthcare facility as an election judge, you want to make sure that you're familiar with a few of these forms. Some examples are the voter registration application. There's an absentee ballot application. And then, of course, the absentee ballot signature envelopes. There's different versions of those envelopes, so make sure that you're using the correct version for the situation that's in front of you. And we'll have instructions on all of those envelopes.
And then, of course, we're not going to leave you hanging. So if you ever need any sort of assistance, you can contact our office. This is prior to your deployment as a healthcare facility outreach judge, or on the day of providing healthcare facility voting. Christy's introduced herself. I've introduced myself, so you can see contact information for us. The best way to get a hold of us, though, on election day for your healthcare facility is to call our main elections line, which is at 507-304-4341. You'll also notice the name Trevor on this form. Trevor is the individual who would have worked with the facility contacts, so they may be listing his name or mentioning him. We want you to be aware of him. Any of us three on the team can provide assistance if you have any questions. All right, and that is actually the end of our presentation. So now that we've given you a little bit of time to talk about and think about some of these FAQs on your own, let's actually come back and just highlight one or two off of each of these slides for you. So Christy, who cannot act as an assistant to a voter?
The folks who can't act as an assistant to a voter would be an employer of that voter or a representative of that voter's union. Those folks cannot be assisters in the voting process.
Yep. And then also, if a voter or somebody else in the facility is asking you what does happen if someone passes away before the election day, but after they've cast their ballot, we do run audits and receive information regarding that. So in that unfortunate circumstance, that ballot will not be counted. It's not allowed to be counted if the voter is not alive on election day. Another question that's interesting here, let's remind everybody who can be a witness for the absentee voting process.
All right, so to be a witness in the absentee voting process regarding healthcare facility outreach can be you as the election judge, you're serving in the capacity of an election official. The resident of the facility that is pre-registered can be a witness. Actually, really any Minnesota resident can be a witness on healthcare facility outreach day. They just have to witness that the voter filled out the blank ballot and completed that process independently or with whatever assistance they provided.
Sometimes the easier way to think through that one is who cannot be a witness, and who cannot be a witness would be the voter themselves. They can't witness their own absentee process, and it cannot be somebody who is not a registered voter in the state of Minnesota.
All right.
Okay, if we want to skip through, I guess we have one more slide. We can just pick one of these. How do we maintain privacy, Christy? What are some of the best practices for our election judges?
If there's a large room used in the elections process for the healthcare facility, we'd want to make sure we're in an area of that room that there aren't other people around. In Blue Earth County, our facilities, we make sure that we use conference rooms, rooms that aren't generally used during that time frame. So we're not going to do this in front of a TV or anything like that. And so we do a great job of maintaining the privacy. I think that the most important thing with this is when you're working with your voter, you and the other election judge are working with your voter to make sure that the next voter doesn't come into the room prior to that first voter being finished with that process. They'll kind of be lining up outside the door, and that's okay. You just want to make sure you've given your voter enough time to complete the process independently.
And Christy, I'll add one more thing there. Sometimes as a healthcare facility judge, you'll actually be bringing the voting process to that resident's room if they're not able to come to your congregate room, that conference room that Christy described.
Sure.
So in that instance, don't forget that some of those rooms are only semi-private, and we need to make sure that there's not a voter or a staff member or somebody on the other side of the divider curtain that might be overhearing the process. So even though you might feel like you're in a private room, we need to just kind of be aware of our surroundings and ensure that privacy to the best of our abilities for that voter's rights. Okay. So there we go, folks. I do think we made it to the end of the presentation here. We hope you found this helpful. We'll just remind you once again that the site that you retrieved this video on is our Blue Earth County Election Judge training site. Also on this page, you're going to find a link to the slides that we just clicked through, so you can use that as a resource. And then I'm also going to encourage you once again to watch the video on aging sensitivity. That will give you some other tips and some other things to think about as you get ready to work in a healthcare facility to provide healthcare facility outreach voting. If you have any other questions, don't hesitate at all to contact us. And until we meet you in person when you pick up your supplies, we hope you're doing well, and we look forward to seeing you as you help us with healthcare facility outreach voting. Thank you.
Thank you.